There's a lot of research out there that suggests that the transmission of bugs and bacteria from carpet to hands is a lot less when you come into contact with microbes on carpet than it is with a hard surface floor. And that's because the carpet fibers tend to hold on to dirt and bacteria before it's cleaned. Whereas on a hard surface floor, it's just present on the surface of the floor.
Public health. It's on everyone's mind these days, from hand washing to emerging pathogens. Welcome to Transmission Control, an infection prevention podcast focused on your appetite for trailblazing thought, discussion, and innovations that will help you make informed decisions. Each episode, we speak with public health experts and safety champions from across the globe as they share their experiences, passion, and opinions. From investigative journalism to medical publications, we tackle real-world barriers to halting the spread of disease. Whether you are tuning in for education, inspiration, or to hear the stories that need to be told, thank you for joining us. And now, get ready to blast off with your weekly injection of insight on transmission control.
This week on Transmission Control, we speak with Catherine Hilliker, Marketing Manager at Danfloor UK, an Ulster Group company. And Larry, I saw something that Catherine posted on social media, and it was talking about infection control considerations in interior design. And that really sparked my interest because we're always looking for topics that maybe are off the beaten path a little bit and not something that everybody is talking about on a day-to-day basis, so we can bring new value and new discussions to the table. And this one really stood out to me. And I think as everybody goes through this interview with us and Catherine today, you'll even hear me have some aha moments, some considerations that, especially as I had worked in long-term care, and a lot of the conversation is going to be more in that residential care setting, but I've worked in those settings, and there are some aha moments for me looking back over my nearly 30-year nursing career as a CNA and as a registered nurse that I don't think I thought of, especially early on, that are really prominent, and also emphasizing partnerships between environmental services and that infection control design, because the long-term maintenance kind of gets handed over to other members of the team. And so this is going to be a really interesting conversation today, Larry, and I know you're going to have some great things to add to the conversation.
Yes, so flooring is not something that I focused on too much. We kind of see it as verboten. If something falls on the floor, it's soiled. The issue, though, that I'm eager to talk about and to learn about, because I really know very little about this, is how the design of the flooring can assist us from an infection prevention standpoint so that certain types of organisms or viruses that might be on the floor and become aerosolized because of staff moving around, how this aerosolization could create serious infection problems. So I'm very interested in learning about the flooring and how we can prevent aerosolization. Safety is often achieved and improved by the air flowing downwards toward the floor in the operating room. So I think Catherine's going to really give us some very, very interesting insight into this whole new world for me as to how to design the flooring to improve patient safety.
Yeah, and if you listened to our recent episode talking about uniforms and the potential spread of infection, this leaps right off of that conversation around wearing shoes to the facility and then bringing them to your home environment as well. So yes, the floors can not only be a source of the spread of infection in the healthcare setting, but also when you return home, as we tie those two conversations together today. Stay with us. We'll be right back with Catherine Hilliker, Marketing Manager at Danfloor UK, an Ulster Group company. I'm Justin Poulin.
And I'm Dr. Lawrence Muscarella.
From 17 Studios, let's get into it. This is Transmission Control.
Joining us now is Catherine Hilliker, Marketing Manager at Danfloor UK, an Ulster Group company. And Catherine, we saw a post that you put on LinkedIn and really thought that this was a topic that's under discussed, maybe even under considered, which is really infection control, but as it relates to interior design, and specifically for the conversation today in the healthcare setting. Obviously, infection control is all over, public health and conversations. So I think it's a broader conversation in general, but because we're typically talking to folks and our audience is in the healthcare setting, we're going to make sure we keep it to that area today. But I just wanted to thank you so much, not only for coming on the show to share your insights, but for really bringing that conversation out, because there are so many other areas of infection control that we focus on. And you never always think about, just the interior design, the flooring, and and it's the dirtiest thing going. So Catherine, thanks for coming on.
You're welcome. No problem. Thanks for having me.
Why don't you tell us a little bit about your background, right? And why you're passionate about interior design and specifically the infection control aspects?
Yeah, sure. So I've been working with Danflor for many years now, and our biggest market sector that we supply into is the residential care market. Now, obviously, for many, many years, infection control has always been a key concern for them. It's not just recently with the pandemic where it's highlighted the need of being clean and conscious of making sure surfaces are infection-free for us that we've realized recently. But for them, it's always been a key concern within interior finishes. And obviously, as the residential care market is a key market for us, we need to get across that message that actually carpets may not be as difficult to clean and difficult to maintain and as full of bugs and bacteria as people actually necessarily think they are. So yeah, it's an aim of ours to convey to everyone.
So I think you're right. We're going to get into that stigma as we go through, this conversation. I do think, even as a care provider in the past myself, working as a nurse, that I sort of assumed, that a vinyl floor was the easiest to clean and whatnot. But even broader than carpets, before we really get into carpets and flooring, what are some of the, high level interior design considerations in the healthcare setting, even beyond that? Like, what are some things that people talk about regularly, either in a renovation or in a new construction?
Okay, so within residential care settings, we have to remember that ultimately this is someone's home. It's also a place of work, and that many of the residents could be living with cognitive disabilities, with deteriorating eyesight. So, but at the end of the day, as I said, this is someone's home. So it has to be familiar to them. It has to be warm. It has to be welcoming and ultimately comfortable and livable. But also many things such as fixtures and fittings and even the layout of the building really has to aid with navigation and maintaining social interaction, because as soon as you take the ability to communicate away from somebody or the ability to move around a building, you're going to affect their mental health and their quality of life. So it's really important to consider a lot of design elements, and that could be lighting. It could be colors of the walls and the floors. It could be the type of chair that they choose to sit in. I mean, for the elderly, for example, they can be sat in a chair for many hours a day. So if it's not built to be comfortable and to accommodate that seating position, it can cause problems with movement and things like that. So yeah, there's a lots of considerations that need to go into helping, as I say, with navigation, but also anything that does go into a care setting has to be practical. It has to help with cleaning. It has to have infection prevention and control in mind.
And kind of designed in. Yeah, absolutely.
Mm-hmm.
And I think about, especially in long-term care settings, with the focus being on preventing pressure ulcers, which can really get away from you pretty quickly. It's not just the material. You just mentioned the construction, of furniture to really relieve pressure from the bony prominences, et cetera. There really are a lot of considerations that way, because, once a resident in that long-term care facility or a patient in a hospital gets a pressure ulcer, you have an entirely different conversation on your hands for certain. We talked about it a little bit at the beginning, just these assumptions about carpet specifically. And like I said, as a nurse, I always kind of thought that vinyl flooring would be easier to clean, or more cleanly than carpet. So as we set the table for this conversation, what are some of those common assumptions about carpets and the ability to clean them?
Okay. So I think the biggest misconception that we come across in the industry is that carpets take longer to clean and they're more costly to clean properly, when in fact there's a lot of evidence and research which suggests that this isn't entirely true. I think with the correct knowledge and the correct equipment, actually carpets are a lot quicker to clean and actually cheaper to clean. So that's the biggest misconception that we come across.
Well, Catherine, there's an issue that comes up that you wrote about, and it has to do with different types of organisms or pathogens that may survive better or not as well on certain flooring, such as linoleum. None of this is obvious to me. So could you explain to the audience why, for example, VRE might survive less well on a carpet than on, say, linoleum? And then that will kind of tee me off for a follow-up question. But that's not obvious to me. VRE, C. diff, Clostridium difficile. Why is the flooring so important in terms of the surfaces on the floor becoming reservoirs, if you will, for these pathogens?
Yeah, sure. I mean, there's two angles that I can take to answering that question. So the first one, in terms of our carpets, they come with a permanent antimicrobial protection on them. So this kills on impact 99.99%. So that's a 4-log reduction of microbes, whether that's bacteria, spores, dirt spores. So with linoleum products, some of them have a natural antimicrobial agent or element to them, but those have a lot lower kill rate and they take a lot longer to activate. So say you have a body fluid spill on a carpet that has the antimicrobial agent in, that will get to work straight away and start to reduce the microbial loading. In addition to that, there's a lot of research out there that suggests that the transmission of bugs and bacteria from carpet to hands is a lot less when you come into contact with microbes on carpet than it is with a hard surface floor. And that's because the carpet fibers tend to hold on to dirt and bacteria before it's cleaned. Whereas on a hard surface floor, it's just present on the surface of the floor. So say you were to have a trip or a fall, or if there's a child on the floor crawling around, the transmission of bugs and bacteria from your hands to that person is a lot more likely on a hard surface floor.
So, Catherine, that leads me right into kind of the 30,000-foot question, if you will, that we talk about when we see in the operating room. There's the classic example of a surgical instrument falling on the floor. And of course, we then conclude that it's contaminated, it's dirty, and we all get that. But when we look for data that actually supports transmission, or we'll say outbreaks in hospitals from organisms or pathogens, viruses that may be on the flooring, this seems not to be that much of an issue, right? You've talked about the flooring not really being the critical surfaces. Mm-hmm. So can you kind of educate me and the audience a little bit about, if the flooring isn't so much of a source of the outbreak, and yet we all know we have to pay attention to the flooring, there's a little bit of a disconnect there for me. So why so much emphasis on the flooring if the flooring isn't really a direct vector for transmission of these pathogens, or is it?
So I think you've hit the nail on the head really there, in terms of when we're looking at environments, we're talking about touch points. So in terms of transmission, there are certain surfaces that are considered highly at risk of transmitting bugs and bacteria. So we're talking about door handles, we're talking about desks, and we're talking about bed rails and things like that. Now, obviously the hospital environment is very much different to a residential care home. Right. So we're talking about non-clinical environments here. But at the same time, we also have to be mindful that because it's a multi-dwelling residence, that transmission could or can be an issue. But it's also, a lot of people come from a clinical environment into a non-clinical environment. So they bring with them a mindset that everything has to be infection prevention and have infection and prevention control in mind. So they then start thinking, well, I need to think about the floors, I need to think about the curtains, I need to think about the cushions, when you still need to be mindful that this is someone's home at the end of the day. They need to have these soft fixtures and furniture, but at the same time, we need to make sure that these are produced in a way that help with infection prevention and control.
And of course, seeing blood or seeing soil on the floor causes us all concern. But you also talk a little bit about allergic reactions and something that I hadn't really thought about, but is so obvious, which is odor. So if we walk into a room and it doesn't smell good because the rug, the carpet, or the flooring was wet, and we get mold developing, this can be a serious problem from an infection control standpoint. Yes?
It certainly can, yeah. And mold can develop on any flooring finish, especially if you don't have, well, carpeting's one of them. If you don't clean it properly and it doesn't have what's called an impervious membrane, so then spillages can leak underneath the carpet to the subfloor and start deterioration underneath the carpet backing, which can be a big cause of odor issues. But even with hard surface floors, I mean, unless you have them fitted, up the walls and things like that and properly sealed, a lot of people in residential care settings in the UK particularly like the plank effect and wood effect and things like that. And if there's any gaps in the tiles, then again, liquid can seep through those tiles as well. So you just have to be mindful that you're creating a flooring which is fully impervious so that liquid can't seep through and can't start breaking down the floor underneath and causing those odor issues. So,
do we get a lot of situations where you can have, let's call it aerosolization, where, for example, if you might have mold in the carpet? I know there was a couple reports in the U.S. about tiling, for example, in an operating room setting, and there was the concern that as people are walking on the flooring in the operating room, that you could create kind of drafts and vents that might aerosolize this debris that otherwise would be isolated and separate from the patient, that now you could actually indirectly introduce it into the sterile field. Do you see that as being a big issue here?
From my knowledge, in terms of indoor air quality and dust within a room, that can aggravate respiratory tracts. And obviously with the elderly, that can be quite a key concern because they might be living with breathing difficulties. With carpet, if there's dust in the environment, the carpet fibers actually trap and retain that dust. So as somebody walks into a room, the dust stays within the carpet, or say a window is open, the dust again stays within the carpet. But if you have a hard surface flooring, as soon as air travels into that room, it can pick up those fine dust particles, bring them into the breathing zone, and then they can be inhaled. And that's when dust particles actually can cause aggravation. So a lot of people in the UK, if they've got an asthma sufferer, for example, in the home, will rip out all the carpets, when actually that could cause issues, because as long as you're regularly vacuuming your carpets, that the carpet will retain the dust, and then you can vacuum it, take out all the dust. But obviously with hard surface floors, it remains on the surface of the floor and can cause an issue.
And in the operating room setting, we're of course not talking about carpeting. We're talking about flat surfaces that are impervious. Yes?
Yeah. So I guess that would have the same effect. So if you've got a hard surface that's impervious, if you have any dust particles or dirt particles within that hard surface, as soon as there's any ventilation within that room, or somebody walks in or walks out, then there's going to be movement of air. So yes, particles could float up into the upper areas of that room.
You talk about the ability for mold to grow on hard surfaces. And I know sometimes people might think, I'm not so sure about that. But I could tell you, if you don't wash your water bottle, stainless steel water bottle, very frequently, if not after every single use, you will see mold beginning to form inside your water bottle. So that's a physical representation from our day-to-day life that sort of proves that point. Because a lot of times people think, no, it's got to be sort of porous and spongy in the way that it absorbs water for mold to form. And I think that was a really good point that you made there. And I want to dive into a little bit, and I know it's amazing, this interview has moved along very quickly, but are there any industry guidelines or recommended practices that really, impact the industry or guide residential settings or acute settings in this regard?
There are obviously recommendations about cleaning and maintenance, but the key point that can be taken is that any floor surface can be installed within a residential care setting as long as it's maintained properly. So there are certain recommendations about how much chlorine you should use. We've also always got to remember that a mop and bucket may be considered a good cleaning tool for hard surfaces, but once you've put a dirty mop into a bucket of water, the water is contaminated, the mop's contaminated, and how often are you cleaning and changing your water and things like that. So you need to have used enough bleach and things like that. But in terms of carpeting and in terms of our recommendations, as a manufacturer, we recommend having a cleaning and maintenance schedule in place from day one. This not only keeps your rooms clean, but it also prolongs the life of the carpet. And depending upon how much foot and wheel traffic is passing through that room or that location will determine the regularity of cleaning. But we would always recommend daily hoovering, regular spot cleaning if spillages do occur, and then interim and long-term maintenance regimes. But it's wise to consult professional carpet cleaners and to get advice on the type of machinery to use. And we kind of recommend techniques such as dry extraction, encapsulation techniques, which reduce drying times in rooms, and also steam cleaning, which obviously again helps reduce drying times. But there's lots of new things coming into the market, like electrically charged water, which has a really large kill rate and can be used with many steam cleaning machines. So I think it's just wise to obviously consult with the professionals when you do have like a residential care setting, for example, to make sure you're doing the best that you can to keep your floors clean, to keep your residents safe, and to prolong the life of the carpet.
You know, you're really tying a recent interview kind of into the fold here. We talked a lot about environmental services in healthcare. And so all those recommendations you just talked about very much tie together with environmental services, because they're typically the ones that are going to execute that policy and that strategy and implement those recommendations. And we also had an interview with Buffy Lloyd-Krejci about long-term care and residential care settings, and the fact that there's not often infection control prevention or a infection control preventionist that's employed in those settings to really educate EVS and other workers in the building. So appreciate you sharing that, because there may be some folks out there that are listening to this podcast who aren't necessarily wearing that singular hat in a residential care setting, but maybe they're a nurse or charge nurse or somebody who's an administrator at a facility who is just trying to brush up on that, and they're wearing, you know, multiple hats, and considering these things is important. Again, we're getting kind of close on time, but I want to talk about the two different types of carpet and what the differences are. And you mentioned before antimicrobial properties. So let's talk about residential versus commercial, and let's focus on the differences between the two.
Okay, so there are many differences. So if I was to pop along to my local shop and select a carpet, you know, I might be looking for if it feels nice, the color. In terms of commercial carpet and selecting a carpet that's going to last in a busy residential care setting, we're looking at things like pile height. So we recommend that a carpet shouldn't be any greater than 5 millimeters, because this allows for shuffling. So if somebody can't walk unaided, it'll allow them to use walking aids. It'll allow for the use of trolleyed equipment and wheelchairs, for example. We also look at the pile weight and the tuff density to make sure that you're getting a commercial grade carpet. But also, as I said before, our carpets are built with antimicrobial properties and an impervious membrane. So they're there and they're ready to deal with liquid body spillages should they occur.
Excellent. And all right, so now we're going to compare them. We just compared two different types of carpet against each other. So now let's compare it against other flooring. And you really mentioned something also earlier that teed up this part of the conversation, but this common assumption that carpets take more time to clean and that they're more expensive to clean. And so let's compare carpet with stone, tile, vinyl, etc. And what are the research findings out there that kind of address those two areas about time and cost for cleaning carpet versus some of the other alternatives?
Yeah, sure. I mean, there's one study that I do like to draw upon when I'm making these comparisons, and it was a study by the Cleaning and Restoration Certification, and they looked at a life cycle cost analysis for floor coverings in a school environment, and they looked at carpet and vinyl composition tile. They did, as I say, a whole life cycle cost analysis, so that looked at the purchasing costs, the cleaning costs, and it was done over a 22-year period. So again, it looked at replacement costs as well, being factored into that. And they actually came to the conclusion that carpet was actually 65% less expensive to maintain than a hard surface floor.
Wow.
So on an annual basis, it suggested that it took 2.5 times longer to clean hard floors than carpets, and that the cleaning solutions and chemicals needed for hard floors was 7 times more expensive than those needed for carpet. So you can see automatically that the time savings, the cost savings can be quite considerable when you look at it over that period of time.
Catherine, one quick question. I think we'd be remiss when we're talking about kind of aerosolization in the healthcare setting. And I'm curious let's talk about COVID-19 for a second as we start winding down. And aerosolization. Does the flooring really play a role in terms of preventing virus from being on carpeting, vinyl flooring, linoleum, where we have a situation where we don't have staff walking around and kind of causing virus particles that may be on the ground to become aerosolized and then inhaled? So is COVID-19 really not part of this discussion, or is it?
I mean, COVID-19 is a virus. Viruses have always been present in residential care settings. So I would say that in terms of it's not a new thing for us. And in terms of the antimicrobial coating that we have on our carpet, it has been proven to be effective against COVID-19. So again, I think you just have to be mindful about the floor finishing that you have in a setting. I mean, if it's not protected, if it's not manufactured properly, then yes, maybe it could cause an issue. But that's not to say that a vinyl floor wouldn't cause an issue either, because as we know that the virus will, if it's on a surface and you come into contact with that and then it enters into your body, whether it's through a saliva particle or whether you're touching your eyes, for example, you could become infected. So any floor covering, if it has COVID-19 on it and it doesn't have any sort of protection or it's not been cleaned, then I think any surface could pose
a potential risk.
Yeah.
Thank you.
Just think about sweeping those floors. I mean, doesn't that not put everything up into the air?
Exactly.
As part of that process? Like, I'm not even sure. And Larry and I had that conversation, with Buffy about, are these environments even really designed with effective air quality controls? Just never really thought about airborne pathogens as much in the design of those facilities and even the cleaning process. So, Catherine, I got to say, I think this is a very unique topic. I don't think it's something that comes up extremely often. It probably comes up more often when there is going to be a renovation or a new construction, and it's more on the engineering side. And I know that infection control preventionists get involved in that, but this is kind of a niche conversation that I'm really glad we had the opportunity to have with you today. And I also know that you're very involved in educating and that you've collaborated with others in the industry to provide webinars on this topic. So I know you're located in the UK, and that's especially where those webinars are being held. Yeah, the other side of the pond. And I think there seems to be a great deal of interest and focus on this conversation in the UK, but can you just tell us a little bit more about that before we wrap?
Yeah, so I mean, especially over the last 18 months where face-to-face contact hasn't been possible, having the likes of webinars and blog posts where you can, and also something called CPD, continuing professional development. So I guess you have that over in the US as well, that making sure that we're getting these sort of messages out via any means possible to help educate people at a time when there's a lot of anxiety, a lot of worry that what you're doing may not be good enough and that you're trying to keep your friends and family or residents safe.
And patients safe. Yes.
Yeah, and patients safe. So yeah, just trying to give everybody the most information that we can so that they can do the best that they can.
Well, very nice job on the show today. Keep up the good work with educating. I'm glad that we can help you get the word out. And I just want to thank you so much for, making some time for us and sharing those insights. And I hope everybody finds you on LinkedIn and finds Dan Floor UK and Ulster Group Company on LinkedIn as well. They can find your education
and read your articles.
Yeah. And so definitely can learn more. Thanks so much for coming on the show today.
Oh, thanks for having me today.
Real pleasure. Thank you, Catherine.
That was Catherine Hilliker, Marketing Manager at Dan Floor UK and Ulster Group Company. And Larry, I really enjoyed this conversation because it's just something I haven't thought about before. And even when she mentioned the mop, I started thinking about the fact that I have seen it where that mop is sitting in a bucket of water, and I know there's chemicals in there, but sometimes it just gets stuck in the utility closet. And I've seen this more in long-term care settings, but I'm sure it happens in the acute setting sometimes as well. That mop is sitting in the bucket in the utility closet, and the water does not always get changed very frequently, and people just wheel it out and mop again. And I'm starting to think about that whole conversation about mold and bacteria in the water. And, that just does not seem clean to me. And I don't know why things like that just get, I want to say overlooked in so many cases because we're running around with all the direct patient care, and there isn't always a situation where environmental services is 100% taking control and handling that in every single setting. And especially as Catherine took us into that residential world, and started talking about there's almost a compromise to be made here so that it's a warm and welcoming and comfortable home-like environment, so that there are soft effects and, comfortable furniture and all of that. So it doesn't feel like a stale. Yeah. It's like, and especially when you start talking about people with like dementia and Alzheimer's, like putting them in that stale, almost, clinical setting, I think would be very discomforting. And she brought up the mental health part of that. Yeah. So it requires us all to balance all these various priorities in the industry. And, it ties to several interviews that we've had recently as well. And so I'm kind of seeing a picture that I had not taken into such consideration before.
Right. And it also, in addition, it brings us into current events, right? So when you're talking about the mop and then you take the mop out of the bucket and you start splashing the mop on the floor, let's say we're in an endoscopy suite, let's say we're in a patient room or in the operating room, there's this whole issue that we've all become very knowledgeable about in the last year of aerosolization of these pathogens. So we talked a little bit about COVID-19 during our discussion with Catherine, but I also wanted to point out that, for example, if we get water in the carpeting or water on the floor, that water can have atypical mycobacterium or mycobacteria in it, in which case we can kind of stir up the bacteria on the floor and cause it to aerosolize. So rather than it being heavy droplets that remain on the floor, there are these certain type of pathogens such as COVID-19, NTM we call it, non-tuberculous mycobacteria, that can actually become aerosolized and can be raised up from the floor by certain activities, staff moving. And another one is the fungal spores from mold. So if we're walking around, particularly for immunosuppressed patients, if we have these pathogens, these viruses, these fungal spores, these atypical mycobacteria on the floor, we can create aerosols of these pathogens so that they float in the air, they kind of remain in the air, and then they can really expose patients to deadly pathogens. So the way we design these rooms and the way we can have flooring to prevent the aerosolization of these potentially viable particles, I think is a really, really important step toward patient safety and something that we really never talk about and I really have not focused on ever before.
Yeah, I even think about just sweeping in certain areas.
Right.
We really need to find an expert out there to talk to us about this aerosolization conversation in multiple different, acute and non-acute settings, Larry. We have to leap off of this and really find somebody. Yeah, I agree. Well, as far as today goes, that's going to do it for the show. But I do want to remind everyone that you can support Transmission Control by subscribing on Apple, Amazon, or Google Podcasts. We're also on Stitcher, iHeartRadio, Spotify, and you can search for us on your favorite podcast application. There's bonus content for some of these episodes as well, and you can access that by downloading the smartphone app for iPhone and Android. We'd certainly appreciate a rating and a review because your feedback is important to the show. And on behalf of Larry and myself, thank you for listening to this week's episode of Transmission Control.